ICU nurses play a critical role in providing specialized care to patients in intensive care units. They monitor vital signs, administer medications, assist in life support procedures, and respond swiftly to emergencies. Their responsibilities require high levels of technical skill, attention to detail, and the ability to remain calm under pressure. Employers look for candidates who are compassionate, technically proficient, and able to make quick decisions in high-stress environments. ICU nurse interviews often assess clinical knowledge, critical thinking, patient management skills, and the ability to work collaboratively with multidisciplinary teams. This video covers common ICU nurse interview questions, suggested answers, and practical tips for preparation. Understanding the role of an ICU nurse. An ICU nurse is responsible for monitoring critically ill patients, administering medications, managing equipment, and documenting patient progress. They must anticipate changes in patient conditions, communicate effectively with doctors and family members, and adhere to strict hygiene and safety protocols. Strong observational skills, emotional resilience, and clinical competence are essential qualities. Employers evaluate candidates based on clinical knowledge, decision-making ability, communication skills, and teamwork. Demonstrating experience in intensive care settings, handling emergencies, and providing patient-centered care can make a strong impression during interviews. Question 1. Can you describe your experience in intensive care? Here's how you can answer. I have worked in the ICU for X years, caring for critically ill patients with diverse medical conditions. My responsibilities included monitoring vital signs, administering medications, assisting in invasive procedures, and collaborating with doctors to develop care plans. I have experience managing emergencies, using life support equipment, and maintaining meticulous patient records. Tip: highlight ICU-specific experience, technical skills, and familiarity with critical care protocols. Employers value candidates with hands-on ICU experience. Question 2. How do you handle high-stress situations in the ICU? Here's how you can answer. I remain calm and focused, prioritize tasks based on patient needs, and communicate clearly with the team. I rely on my training and protocols to make informed decisions quickly. Staying organized and maintaining composure helps me manage stress effectively while ensuring patient safety. Tip: emphasize composure, prioritization, and teamwork. Employers look for nurses who can handle life and death situations confidently. Question 3. How do you monitor and assess critically ill patients? Here's how you can answer. I continuously monitor vital signs, observe patient behavior, and assess for changes in condition. I use monitoring equipment accurately and document all observations. Regular assessments allow me to detect early warning signs and communicate them promptly to the medical team, ensuring timely interventions. Tip: highlight observation skills, accuracy, and vigilance. Employers value nurses who can detect subtle changes in patient conditions. Question 4. How do you administer medications safely in the ICU? Here's how you can answer. I follow the 5 rights of medication administration: right patient, right drug, right dose, right route, and right time. I double-check prescriptions, monitor for adverse reactions, and document all medication administration accurately. Safety protocols and attention to detail are critical to preventing errors. Tip: emphasize adherence to protocols, attention to detail, and patient safety. Employers prioritize candidates who maintain high standards of care. Question 5. How do you handle family communication in the ICU? Here's how you can answer. I provide updates clearly and empathetically, ensuring that family members understand the patient's condition and treatment plan. I answer questions patiently and refer them to the medical team for complex decisions. Maintaining transparency and compassion helps families feel supported during stressful times. Tip: highlight communication skills, empathy, and professionalism. Employers value nurses who can manage sensitive conversations effectively. Question 6. How do you prioritize patient care when multiple critical cases arise? Here's how you can answer. I assess each patient's condition, prioritize based on severity and potential complications, and coordinate with the medical team. I delegate tasks appropriately and use time management strategies to ensure that all patients receive timely and effective care. Prioritization ensures optimal outcomes in high-pressure situations. Tip: emphasize critical thinking, decision-making, and teamwork. Employers want nurses who can manage complex ICU workflows efficiently. Question 7. How do you respond to sudden emergencies, such as cardiac arrest? Here's how you can answer. I follow the hospital's emergency protocols, initiate life-saving interventions like CPR or defibrillation, and communicate clearly with the team. I stay composed, assign tasks as needed, and ensure documentation is completed afterward. Training, quick action, and coordination are key to effective emergency response. Tip: highlight emergency response skills, calmness under pressure, and teamwork. Employers value nurses who can act decisively in critical moments. Question 8. How do you ensure infection control in the ICU? Here's how you can answer. I adhere to strict hand hygiene, use personal protective equipment, sterilize equipment properly, and follow isolation protocols for infectious patients. Maintaining a clean environment protects both patients and staff, reducing the risk of hospital-acquired infections. Tip: emphasize hygiene practices, vigilance, and adherence to protocols. Employers prioritize candidates who maintain a safe ICU environment. Question 9. How do you handle documentation and reporting in the ICU? Here's how you can answer. I document patient observations, interventions, and changes in condition accurately and promptly. I ensure that all reports are clear, complete, and follow hospital standards. Effective documentation helps the medical team make informed decisions and ensures continuity of care. Tip: highlight accuracy, organization, and attention to detail. Employers value nurses who maintain reliable patient records. Question 10. Why should we hire you as an ICU nurse? Here's how you can answer. You should hire me because I bring hands-on ICU experience, strong clinical skills, and the ability to stay calm under pressure. I am committed to patient-centered care, efficient collaboration with the medical team, and adherence to safety and hygiene standards. My dedication and expertise make me well suited to provide high-quality care in the ICU. Tip: summarize your strengths: clinical competence, critical thinking, teamwork, and patient-focused care. Make your answer confident and concise. Final thoughts. ICU nurse interviews assess clinical knowledge, decision-making, patient management, communication, and teamwork skills. Candidates who demonstrate ICU experience, technical competence, and the ability to handle high-pressure situations stand out. By highlighting relevant experience, emergency response skills, and patient-centered care practices, candidates can show employers they are capable of providing high-quality care in intensive care settings. Composure, empathy, and adherence to protocols are essential for excelling as an ICU nurse and ensuring positive outcomes for critically ill patients.